Welcome everybody to this webinar about how to apply and get involved for the Baltimore Health Core Initiative. Today we are lucky to have Jason and Naila with us from the health department who are a part of this initiative and will be kind of walking us through the process to apply, but also what makes a successful candidate, and then a little bit of the history and background of the system that involves many different stakeholders across the city and state. Thank you so much for joining us today, and I'll let you two introduce yourselves.
Thank you so much, Nigel. Good afternoon, everyone. So I'll kick us off. My name is Naila Mag with Phoenix. I am the HR Director for the Baltimore City Health Department.
Hello, everyone. I'm Jason Smith with the Baltimore City Health Department. I am acting as a COVID case investigation manager right now. So overseeing a lot of the case contact tracers right now.
Over the last couple months, Baltimore City Health Department has worked in conjunction with our partners across the city to really put together a robust program around contact tracing and case investigation. So today we wanted to talk to you guys about the job opportunities that we currently have available to inspire you to apply. There are approximately 400 or so positions that we are looking to fill, and we've spent thousands of hours altogether pulling this off. And so it's been a very meaningful process. It's been a very thoughtful one, and we are looking for individuals that share in our values, that are very interested in really doing this good work for our city, and people who are passionate.
We'll look for people who just want to make a difference, specifically in their city, in their state, and really want to just try to help slow the spread. And you'll learn just the effectiveness of what we're doing here and all the impact that we're making. And you really want to have your hands, to the ground, to the plow, and actually making a difference. This is definitely, listen to the perfect webinar today if you're highly interested in doing this type of work, because that's what we're doing, and we're looking for you.
Yeah, we're certainly trying to hire individuals who are interested in stopping the spread of COVID-19. We're very committed to making quality hires as well. So we want to talk to you guys a little bit about what the recruitment process is like. Most of our positions are being filtered through our partners, Baltimore Core. So to see the positions, you can go to baltimorecorps.org. They're also posted on the baltimorecity.gov website under the careers tab. Either way, you can see the positions. If you hit apply, it all goes to the same place. In terms of the application process, once you've applied, you'll be vetted through Baltimore Core. You'll also, for most of the positions, receive a video interview. So in these times of COVID-19, we've gotten very creative in terms of how we are trying to recruit and socially distance at the same time. You'll be invited for a video interview. And then after you get through your video interview, you would be invited for a face-to-face interview for some of those positions as well. At that point, if you get through that whole process, then comes the onboarding stage, where you would go through like your typical background checks, drug tests, reference checks, those types of things, be given your offer, and then able to start working. So I wanted to talk a little bit about some of the benefits that we offer for these positions, and a little bit about kind of how the positions are structured. So these are temporary positions. They can last anywhere from 6 months to 12 months. It really does depend on the position. And some of the positions also have the workforce development support attached to them. So for example, our partners at Maryland Office of Employment Development have really put together a great program where they will help you seek alternative employment after this assignment is over. And really help you increase your skills, your KSAs, so that you can find other alternatives once the assignment ends. Additionally, there is a stipend given to most of the positions, if not all, of $208 each pay period that goes towards benefits. you wouldn't be able to sign up for benefits through the city, but we would give you that stipend in order to be able to purchase benefits elsewhere. You would also be eligible for sick and safe leave. That is something that you would be able to use if you have a sick child or you yourself become sick or have an emergency. You would at least be able to have some time off and still be paid for it. So a couple of the positions, I wanted to rattle off some of the types of positions, and then I wanted to pass it over to Jason to kind of give a little bit of detail about what the job actually entails. So we have contact tracers, case investigators, couriers, administrative staff, directors, managers, supervisors. We have so many. I think Jason will probably just talk about kind of the higher level ones that we have the most frequency for. I also wanted to add that in terms of the location for where the positions are located, we have opened up a brand new building down in the Pigtown area on Wacomico. So a lot of the positions will typically be a hybrid telework / in the office type of position. And we have several shifts available as well. We have 2 shifts that are 4 days a week at 10 hours. And then we have a 9 to 5 Monday through Friday, as well as a 11 a.m. to 7 p.m. Monday through Friday. So there's various shifts. We have a little bit of something for everyone. So Jason, I'll pass it off to you to kind of give a little bit more insight on the position job descriptions.
Thank you, Nyla. So we have a whole team, a large team that we're trying to bring on contact tracers. You'll be joining in on an existing team of contact tracers. And what that position is we're literally the ones that are contacting those who test positive for COVID-19 and also those who are exposed to COVID-19. And so we're the ones making the phone calls. And as we are interacting with individuals, we are literally, reaching out to our community, trying to find out where they've been, to try to find where their exposures have been in the community, trying to find symptoms, and also trying to link them to resources, trying to prevent outbreaks from happening throughout the city or even responding to outbreaks that are in the city. So this is probably the most important job that we have here because contact tracing is known statistically helping to stop the spread of infection. We're putting people on isolation, quarantine, really trying to keep the community safe. And so that's one of the major points of the contact tracing job. You learn the system, you come on, you get trained. We have a pleasant training staff that you'll learn everything that you need to know about contact tracing, case investigation, learning about the system that we're using, really just equipping you and making sure that you have everything that you need to make sure that you are equipped to handle any kind of call that you get. And you will get different types of calls. So it's not a boring job. It's very exciting. One is exciting because you talk to so many different people. You get to learn about so many things that are happening in the community. But the biggest thing is you get to help them, walk them through this process and then making sure that they're safe and that their family is safe and their friends are safe. And so that's the contact tracing position. We also do have supervisor positions for those who may have some sort of background in this position or background in that type of work, not necessarily COVID-19, but maybe you have some transferable skills, some management experience, or maybe just desire to be in a managed position. We do have supervisory positions available. They will oversee a team of contact tracers, case investigations. That job specifically will not just have the oversight, but they'll be doing a lot more problem solving, a lot more critical thinking, maybe working a little bit more intricately with the outbreak teams, might be compiling a little bit more data. So you can see how the job changes a little bit on the supervisory level. And then you have the manager level who is doing a lot more meetings, a little bit more administrative tasks, a little bit more data, and also working with other partners as Nyla has previously discussed. So those are some of the different positions that we have and that I've just tried to describe for you. All of them are so equally important. All of us work together as a team as we try to effectively impact this disease.
Great. The Baltimore City Health Department is a great agency to work for. We do great work even outside of COVID-19. We would love for you to be a part of that too. We love the work that we do, and our people are really mission driven and do it because they love it. And hopefully that gives you inspiration to apply to, because we would love to meet you. We would love for you to be a part of this with us. And I just wanted to one more time say thank you to everyone who had something to do with this. Rockefeller Cares for the grant money to fund all of this. Maryland Office of Employment Development, Chapigo, Baltimore Core, HCAM. I think I'm missing somebody else, but thank you to everyone, because the Baltimore City Health Department and others, we could not have done this by ourselves. So we really appreciate everyone and everything that they have done to help make this a reality.
Thank you so much for your time, and very grateful and thankful for the work that you're doing.